After trauma dumping, a lot of the traumatic experiences I have experienced in the ICU throughout my years as a nurse, you guys asked me a lot of questions along the lines of, well, how do you take care of yourself when you're experiencing so many hard things? So I thought I would share a couple things that work for me. Maybe they'll work for you. And then if you have any other suggestions, please leave them down below so we can help out nurses that are maybe newer to the game that are going through these hard things for the first time. You have to treat yourself like you are the most important person in the entire world. You know this already, but we cannot pour from an empty cup. So if you are feeling depleted mentally, physically, emotionally, socially, then you need to take care of yourself before trying to help anybody else around you. That's really hard to do because we are nurses and we are givers, we're caretakers, and we like to put other people before ourselves. And so this is a very hard skill to learn, especially when you are new. After my really hard shifts, two things really help me. One, I talk about it. I talk about it to my husband, or my mom is a good resource for me. I've got lots of friends that are nurses. So find your people, your inner circle. And if you have someone in that inner circle that you trust that you can talk to about these hard things, do it. Sometimes right after a hard shift, I just need to be quiet and decompress. I ride home in my car with no music, no stimulation, because my head is so cloudy. And so if you can't talk about it right away, that's okay. But at some point, make sure you're addressing these hard things so you're not just storing them in your mind. The next thing I do is also make sure I'm watering and feeding myself like I'm a plant. I make sure I come home, take a shower, eat something, and take care of my physical needs. Coming home that night after a traumatic shift is not the hard part. It's the next days after for me. I feel mentally and emotionally and physically exhausted. And so I try to give myself grace when the next day I feel like I am emotionally hungover. I've got two kids, so it's hard to rest, but I try to have lazier days, movie days, do the things that I like to do, read, relax. If I want to go to the gym and exercise, I'll do that. But I try to do the things that I know make me feel better. I also have to remind myself a lot that the patient's outcome is not a reflection of me. I did everything that I could. I did my best job, and bad things happen to good people. And there's still nothing else that I could do, but I can rest confidently knowing that I took the best care possible of this patient, regardless of the outcome. And lastly, I see a therapist. I see her about once a month. We talk about my own personal things, my professional life, things that I see at work. And it just helps me to have that unbiased opinion of someone that can hear things that I've gone through, as well as give me tools for coping with these things. I'd love to hear any other tips and tricks from you guys after your hard days. So please let me know in the comments below.